Welcome everybody to our YouTube channel for Project 31. We're so glad that you're joining us today. We are going to be talking about reconstruction and just the different types of options. Obviously, we are not doctors, we are survivors, but we kind of just wanted to talk through just some different ways or different things that you can consider. I think when you get into the plastic surgeon's office, a lot of times it's overwhelming, and I feel like they're just saying a lot of information really fast, and we might not know all the potential options that are available to us because I don't know if they're necessarily presented all the time. So I just wanted to say, first of all, you can go flat, which means no reconstruction, obviously. So I know you did a lateral mastectomy, so that would mean she did one, and then she had
mine was even like, it was not even a full
partial
mastectomy, it was partial. So it was like an ice cream scoop out of my breast. So
and
I had
then
a
she
weird
left
looking
one
breast.
of them. Yeah. And again, this was 20 years ago. So obviously things, and like we've told you guys before, things are always advancing, changing, morphing. So as of right now, you know, a lot of people that we've been seeing and talking to recently are going flat because they just feel more comfortable
Especially if
doing
they
that
have a
option.
double.
Yeah.
I think it would be awkward.
Different.
It would be challenging to stay flat if you just had one.
So if you did go flat, you could wear a prosthetic or not. That's up to you. So there's options for that. So that is if you did non-reconstruction. So then over here, you've got two different avenues you can go to for reconstruction.
Well, actually, so you could do deep flaps are popular.
So we've got implant reconstruction,
Yes,
or we've got
non-implant.
flaps.
Yeah, or natural tissue reconstruction, I guess is what they call it.
Right.
And so the flaps would be using mostly your natural tissue. Now you also have an implant though with your flap,
Yeah.
right? So sometimes that happens too. So, so like I had a lap flap, which just means they take part of your latissimus dorsi muscle from the back, move it around front, build a little breast tissue out of it, build a little breast out of it, and mine's all natural. Now you can, if you're a good candidate for it, have an implant behind that to kind of give you a little more volume, because there's only so much volume you can get from natural tissue. You're not going to be able to build big breasts out of any amount of human tissue. I mean, I don't care. It just doesn't work, right? You just can't get all that volume again.
Well, and the other thing, this was where it can get confusing, is that, let me just say, everybody is unique.
Absolutely.
And everybody has a different path. We just kind of wanted to explain some different options.
Right.
And just because it was available to us doesn't necessarily mean it would be available to you, and vice versa.
Well, and it depends on, were you radiated? If so, how much? What's your BMI? Do you have diabetes? Do you have other things going on in your body? So there's like a myriad of reasons why something would or wouldn't work for you.
Right. So there's a lot of different factors involved. So just coming back to it, so we've got flat, or we've got implant reconstruction. So like Jane said, a lot of times the philosophy, if you are radiated, that typically might not be an option for you on an implant reconstruction. So that means you're going to move over here to the flap reconstruction options, like Jane said, because the radiation can sometimes kill the blood supply. That's why they're not able to put the foreign object in, because then it wouldn't heal if they tried to sew you back. So if you do implant reconstruction, I think most of the time it sounds like they're doing it on top of the muscle. Not necessarily. Again, that's another thing depending on the surgeon, because I've heard both. Mine's behind it, but I think the protocol now is more on top. And then, you know, with that, you might have a tissue expander. So when you go in for your mastectomy, they would put a tissue expander in while they're in surgery, which is simply just a bag that has a magnet inside that will allow them, once you get out of surgery, to be able to access where that bag is inside, and then they'll start to fill it up with saline. So you would go maybe 10 days after your surgery, and they would put the magnet to your chest that finds the tissue expander, they put a needle in, and then they inject saline into it to create a pocket that will later hold your implant. So once you go through that tissue expander process, that's all dependent on how big you want to be, but also how much elasticity you have in your skin. So I was very small to begin with, so I didn't have a lot of room to stretch, didn't have a lot of tissue there. Some people, they do have a lot of extra tissue, and so that's all dependent as well on your specific body. So then you would go back into surgery, they would open you back up, take out that expander, put an implant in, and then sew you up. Then at that point, if you do This is another factor, nipple preservation versus non-nipple preservation. So if you do have your own nipple, obviously you don't have to have anything done. If you did have your nipple taken, then you would need to go and do an areola tattoo if you chose to. That would be the last step. So that's the implant side. Then you've got over here the flap side, like Jane was saying.
Yeah, so then there's deep flap, which they take your tummy. It's kind of like getting a tummy tuck and moving it up to where your breasts are. And a lot of times they'll do that, especially if you need both, because having a double lap flap would just be really debilitating, I think. But a deep flap, if you're having both breasts, and you can do it for one as well, but sometimes if you're doing both, that is the option. And then that can be with or without implants, depending. Some people have implants behind their flaps. So I don't know as much deep, but for sure
I've heard that like once or twice.
I know, I've heard it a little bit.
Yeah, but they do cut you hip bone to hip bone, and like she said, there are determining factors, BMI, whether you smoke, things like that, that will allow you to be a candidate for that or not. But either way, either one, I would like to encourage you guys to see a physical therapist, because before, so they can get a baseline to see where your body is, what it's like, your lymphedema, lymphatics, all of that. So they get measurements on your body, and a lot of times
range of motion, those kinds of things.
Scar tissue builds after you have all these surgeries, and oftentimes when you're in the doctor's office, sometimes some will talk about it. Most don't.
Mine didn't.
And so we are left as patients to kind of navigate this on our own and to kind of piece things together so we have, maximum, mobility and just quality of life when you get to the other side of finishing all these treatments and surgeries. So especially with all the scar tissue from deep flaps, you can kind of be hunched over afterwards because it's so tight from having all that tissue taken. So it's important to lift back out, and that takes loosening all that up. And then same with lap flaps. Like we both have had lap flaps. I wish I would have known that early on, because so much scar tissue is built for me now, and it took years of building, and it can cause ongoing problems if you don't treat it as you go. And I'm not telling you that to scare you.
No.
I'm telling you that to just be
proactive.
preventative. Yeah, preventative. And so
it's certainly manageable. And for some people, like I didn't want to stay flat on one side. I didn't want that. So I was going to look for an option that allowed me to have a breast. And they didn't want me to have implants because I'd had so much radiation. And so I couldn't, so that wasn't an option for me.
Well, and the reason why would they not want you to have an
Well,
implant?
so the radiation can be very damaging to that tissue that it radiates, and just the elasticity. I wouldn't have been able to get much, if any, lift out of an implant. So I would have had,
Not symmetrical.
they wouldn't have been symmetrical at all. Not to mention, they could have not healed.
Right.
Which would have been worst case scenario.
And it can cause capsular contracture, which is what I have. So, like Jane said, from the first time for me, my personal story, again, everybody's unique.
Some people have no problems.
Yeah. And so I had an implant from the first time, and then the second time, the tumor was over here. So we kept the implant in because I didn't want to just have one boob. And then we ended up radiating all of that. Well, I knew at that point I'd be high risk for capsular contracture, where your body builds scar tissue around that, and it just thickens and hardens over time and becomes painful. And so I just knew that. Again, our intention is to educate so you have awareness, so you can be paying attention to your body. And so now it has to go get fixed. So it's just things along the way that I wish I would have known. You don't know what you don't know, and our goal is to hopefully help you to be proactive and preventative.
And if you don't understand the procedure, just keep asking questions until you do. And if the plastic surgeon is not giving you the answers that you need, talk to their nurse or their whoever their person is, their PA in there, because I promise they can answer the questions. If you're not getting them answered there, then call a physical therapist, somebody who deals with breast cancer patients specifically. I mean, there are people out there who can explain it to you in a way that you can understand exactly what's happening and what the potential risks are. Obviously, we can help you to a degree, but we're not medical people, so we don't like to give medical advice at all. We're not going to do that. But it's wonderful to have 2 or 3 perspectives on what this is going to be like anyway. If you can find someone who's had this similar surgery that you're considering, talk to them and see what their experience is. And like you and I have very different experiences with our lat flaps, but we have some commonality issues too. So
Right.
I think, talk to 2 or 3 people, but if your doctor can't explain it in a way that you can fully understand what they're doing, because that to me was important. I needed to understand, what are you moving where? Now, how is this going to work? And I
Right.
can remember meeting with him 2 or 3 times and saying, okay, just explain it to me one more time. Just
Right.
one more time. I just want to make sure I understand. And he was very patient, very kind, and very good to make sure I understood. He actually sent me home a book that had pictures in it.
That's
and,
good.
Yeah.
Well, and you can ask to see pictures too from the surgeon. Again, that's why community is very important to us. And I encourage you to get onto the Project 31 Survivors community on Facebook. It's a private group of survivors only. So if this is your first time coming in and just watching the YouTube, jump onto Facebook because there's a lot of conversation going on there. You can ask questions too. Like Jane said, it's beneficial just to hear different people's perspectives. But at the end of the day, it's your body and it's your decision. And it's important for you to have a good relationship with your surgeon as well and to feel comfortable and, like Jane said, to have a full understanding of what's going to happen to your body, but knowing that it's your choice what you choose to do. There's benefits to both, but again, there's no judgment towards anyone and whatever they choose to do. One's not better than the other.
No.
Everybody's different and we all make different choices. And
And you got to do what gives you peace.
yeah,
And there's no hurry.
no.
There's no hurry.
Some women are totally fine being flat. That was not an option for me.
Right.
I needed to have something. I was 26 years old, and I wasn't okay with that. But that's me. And so, again, we just want you guys to know that you do have a choice and that there are options. And if you guys have questions, feel free to reach out to us. info@project31.com. We have, as you guys know, Jennifer. She's our certified breast care nurse. She's happy to answer any questions, or we are happy to connect you guys. Even if you're not in the Oklahoma City area, we have resources and access to people who could probably get you the right answer. And so feel free to reach out to us because we would love to be a resource to you to help you out.
Absolutely.
So I hope we gave you some idea of clarification on different options for reconstruction. Again, like the channel, feel free to make a comment. Let us know what you'd like to hear if you have a question, and we will see you guys next time.
Thanks so much for joining us.